Hello, everyone. So we will continue with topic 4 for this unit. The topic is personal protective equipment, which is quite important in dentistry. Okay. The specific learning outcomes. The first one is to discuss the health and safety regulations and the requirements relevant to PPE, to identify specific barriers and or PPE for patients and healthcare workers, protection from exposure to potentially infectious material, and then to describe the circumstances which require the use of barriers and personal protective equipment to prevent patients and healthcare workers contact with potentially infectious materials. So this topic is really important for you to understand the importance of having this PPE when you are working in the clinic, so that you are well protected and also you're protecting your patients and surrounding areas. Okay. And number 4 um, is for you to be very vigilant and also well versed with donning and doffing of the PPE. We will have this practical as well, to make sure that you guys know how to don and doff of your PPE afterwards. Okay. All right, so what is the definition of PPE? So PPE, the popular name for personal protective equipment, is defined as per OSHA, or Occupational Safety and Health Administration, is specialized clothing or equipment worn by an employee for protection against infectious materials. Okay, this is looking at the health sector, but for the other sectors, the definition would be slightly different, not just protecting them from the infectious materials, but from other hazards. Okay, so this is just introduction for the PPE. So if you look at the symbols here, 16% of the workers who sustain head injuries are not wearing head protection. So this is what we're talking in the construction site, right? 90% of the workers having eye injury because not wearing the eyewear, and 60% of the hand injuries can be prevented with the use of safety gloves. So you will discover what are the differences between these gloves. Okay, safety gloves is not the one that we are wearing in the clinic. Okay, 99% of the workers are regularly exposed to noise above the recommended limit, and 77% of foot injuries could be prevented with wearing one of those safety footwear. Okay, and then at the bottom there it says 98% of employees said they have seen others not wearing PPE when they should have been wearing, and 30% said this happens repeatedly. So these numbers are pretty much worrying, for all of us, especially um, for us in the healthcare, because we are exposed to these dangers every single day. Okay, and not just us that we are putting at risk, but we're also putting at risk for our patients, for our colleagues, and the staff in the clinic. All right, so where does this PPE being used? So let's see the industry that using this PPE: farming, construction, definitely, manufacturing, food and beverage, oil and gas, and definitely healthcare and pharmaceutical. Okay, so these 6 main industry or sectors that are using PPEs during at work. Okay, at work. Okay, so as for regulations in Malaysia, particularly We have policies and procedures on infection prevention and control by the Ministry of Health, Malaysia. And from the OSHA side, we have this act, we call it Occupational Safety and Health Act and Regulations. In global perspective, we also have this infection prevention and control of healthcare-associated infections in primary and community care. This is the British one from NICE. Okay, so there are regulations involved regarding this PPE, regardless where you are. Okay. Okay, let's look at the components of PPE. This is particularly for the healthcare sector. Okay, so the first one is the gloves. This is what we call medical gloves. Number two, the mask, which is the most popular attire in entire world at the moment. Goggles, a gown or apron, head cover, face shield, beard cover if you haven't seen it. All right, coverall and shoe cover, ear muff, and disposable apron. So these um, protective equipment or attire can be seen in our clinic or in our faculty as well. If you go anywhere in the world, in the clinics or in dental facilities or medical facilities, you'll be seeing this a lot. Okay, so all of these are actually required to wear this depending on where you are working in the clinic, in the lab, or in the radiology, all those different places. Okay, so let's look at the next one. Right, this is from the British NHS, okay, National Health Service. So this is just a poster showing you the PPEs during the COVID-19. All right, so if you look at the photo on your left, it's just comparing during COVID-19 cases, okay, or pandemic. All right, so you're looking at that from the top, fluid resistant surgical mask, full face shield, and then we have gloves, long sleeve fluid repellent gown, which is what we call apron just now, and then disposable apron on top, just beneath it. Okay, so you can see this PPE being worn in the healthcare facilities when dealing with COVID-19. And the photo on the right side, again depicting the guideline for this COVID-19 management for the healthcare workers. Okay, so you can see the difference of in terms of the PPEs being worn by them. Okay, so let's look at this PPE into more details. Okay, so this is showing you the peri-operative environmental classification. There are three: restricted area, semi-restricted area, and unrestricted area. So every area that you go in the clinic, we can classify it as restricted area, semi-restricted area, and unrestricted area. Okay, so you probably can read those definitions for each of the area on the right side later. Okay, I'm not going to touch that more because for dentistry, our place perhaps more on the semi restricted area. Okay, the restricted area more or less, for example, ICU in the hospital, burn units, these are the restricted areas. Okay, all right, let's look at into great details for the PPE in dentistry. Right, so here Just summarize here the whole PPE that we usually wear in the dental clinic. This is not particularly for COVID-19, but this is the regular ones, okay? So let's look at one by one. Start from the top. So the first one is the head cover. We call it surgical cap, okay? It's not mandatory for you to wear surgical cap unless you are doing surgery or any aerosol, what we call this aerosol producing procedures. Okay, face and eyewear, you can wear goggles or face shield. And then number four is mask. Okay, the body one, you can wear surgical gown or disposable apron. Number seven, the hands, we use gloves. And number eight, for the footwear, there is shoe cover. But shoe cover is not common in dentistry, okay? It's more or less in the operating theater. But some people do wear shoe cover because, the shoes might be contaminated when you go out there. There are some soil involved on the shoes, so you probably need to wear shoe cover. Okay. All right. So surgical cap. The first one, or sometimes we call it buffon. It is an to act as a barrier to prevent microorganisms that emerge from the hair. Okay, we are talking about your hair, which can cause contamination or securing the hair from the surgical debris that being produced during the procedures. Okay, so there are two types of the surgical cap or buffon. One is cloth. You can see the cloth. The one that is on the photo is actually the disposable one. Okay, it's only one time use, but there is another one is cloth that you can reuse many times. All right, many of the surgeons are using the cloth because they bought on their own, whereas disposable is prepared in the clinic that you can wear when once you're done with your patients, you need to take it out. Okay, and this surgical cap should cover all hair. Oh, goggles. Goggles are very important in dentistry because your eyes are very susceptible to trauma produced by the procedures that you are doing. Okay, and not to forget, goggles should be worn by your patient because your patient has as much risk as you are. Okay, in the when or during the treatment. Okay. Okay, so for goggles, it's a tight fitting eye protection that completely cover the eyes, eye sockets, and facial area immediately surrounding the eyes and provide protection from impact, dust, and splashes and vapors. Okay, so if you look at the photo here, if you can see my cursor, there is the sides here has also the acrylic part. The top one also have the acrylic part which prevent the splashes coming from the top and splashes from coming from the sides. Okay, so this is pretty good goggles for you to have. Some goggles will fit over corrective lenses. For example, some goggles are bigger than this because when you are wearing your eyeglasses, this one gonna be on top of it. So this one should allow some space for your glasses as well. Okay. All right, so let's look at the types of goggles available. For the dentistry, we normally wear either impact protection or splash protections. Okay, some patients are wearing laser protection glasses because some of our procedures are using lasers. Okay, and some of our procedures also using UV protection, UV. So we need to wear UV protection eyeglasses, such as this one too. But these three laser protection goggles are not worn by our patient or us. We do have something similar, but less bulkier. Okay, and then the welding goggles definitely not for us. Okay, So as I explained before to you, there are side shields, top shields that you should be aware of. Um, Usually the glasses are made of anti-fog lenses. Okay, there's a bridge there to protect your nose as well. Okay. Okay, so next one is mask. Okay, so a medical or what we call surgical mask is a disposable medical device. It's considered as a medical device, and it's supposed to protect from any infectious agent transmitted by the droplets, but it's not really protecting you from the airborne infectious agent because the type or the material of the mask does matter in this case. What we're looking at is the size of the infectious agent and the size of the pores of your mask, okay? Whether the infectious agent is smaller than the pores of your mask, okay? Therefore, the prevention of this airborne infectious agent might be compromised if you're wearing a different or inappropriate mask. Okay. For the surgical mask that you're seeing on the photo here, does two things. One, it prevents droplets of saliva or secretion from the upper respiratory tract when the wearer exhales. Okay, and also protects the wearer from the infection transmitted by droplets. Okay, or even the splashes of biological fluids in the clinic. Okay. Okay, just showing you the types of the face mask available for the medical sector. If you look at here, the most acceptable mask for us as a dentist is actually surgical mask. Okay, this is the common mask that we wear in the clinic. It used to be known as three-ply mask. Okay, why three-ply? Because it has three layers of the materials. Um, but there are other masks available in the market, which is called two-ply, which not effective for us to wear in the clinic. Okay. The next one, the more common to us in the clinic is N95, which is at the top left here. This N95 is actually works against the virus. It's good against the virus. If you look at here, comparing the components here, 95% virus, similar to the surgical, but for the bacteria, it is 100%. Dust is 100%. Pollen is 100%. Okay, so if you look at the difference between these two, it is more protective against bacteria, dust, and pollen, though virus is still 95% for both. All right, so another one is actually the isolation or isolator, what we call it, isolate suspended particles, FFP1 mask. It is not as good as N95, but it is as good as surgical mask. Okay. All right. The next one is the activated carbon, or when you expect a lot of bad or smelly odor. This is when you are in the morgue or dealing with bodies or cadavers. Okay. All right, the next one is cloth mask, which is the DIY. And you can see a lot of people are wearing this cloth mask nowadays in the public. All right, so shockingly, if you look at here, the virus component here is zero protection against the virus. So I would recommend, definitely recommend to you for this current situation, please do not wear cloth mask without any virus protection. There is a cloth mask that you can change the filter, but again, surgical mask or N95 would be a lot better. Okay, So the cloth mask I'm showing you here is the one that without any filter. So there are cloth masks that have a filter or disposable filter in it that you can change all the time, every time. So that's still not as effective as surgical mask or N95. Okay, and then there is another one, sponge mask, which is useless. So I definitely not recommend for you to buy and use this, and definitely not gonna wear this in the clinic. So in our clinic, the most acceptable for you to wear is N95 and surgical mask. Okay. All right. So there is another word, or there is another type. It's called respirator. Okay. So what is the difference between mask and respirator? Mask usually loose fitting. It may not provide the full protection from breathing in airborne pathogens such as viruses, whereas the respirator, it tightly fits the face and filter airborne particles to protect healthcare workers. And it is claimed nowadays to have more protection, even though this is N95. As you see, N95 have 95% protection against viruses, similar to the surgical mask, but nowadays they are having a better N95 which can protect you better from the viruses. So this is called respirator. So you can see the shape is different. It's a rounded shape and it's more sturdy. This is soft and loose fitting. Okay, the number five, surgical gown. It is a personal protective garment intended to be worn by healthcare personnel when you are in the clinic or doing any procedures. So all dental procedures nowadays considered as surgical procedures, so when you have splash, when you have aerosols, whatever you're doing as a dentist, normally it would contaminated your clothes, so need to wear surgical gown when you're seeing patients and do a procedure. Okay, it will protect both you and the patient from the transfer of microorganism, body fluids, and any particulate matter. Okay, so for the body protection or torso, you can see a lot of types of body protection. We have coveralls, we have scrubs, reflective safety vest, full body harness, cold weather coveralls, lab coat, all the way to the flame resistant splash protection lab coat. So some of these are belong to us as a healthcare provider. So we probably will see this more and more later. Okay. All right. So if you, this photo is more familiar to all of us right now because you can see the healthcare workers are wearing this when dealing with COVID-19 positive patient or even any patients who are suspected for COVID-19 positive. So this is called coveralls. Okay. So if you can see here, it covers from head to toe. um, you can see the whole thing is actually in one piece, so you can just wear at once. Usually we suggest to change every 4 hours because wearing this is not that comfortable and it's very heaty. You can sweat this in very little time if you are not working in the air conditioned room. Okay, so this just show you the disposable medical protective clothing that is available right now. Okay, okay, number seven, gloves. So gloves is actually not a substitute for hand hygiene. So even though you wash your hands regularly, but when dealing with patients, definitely you need to wear gloves. Okay, and you need to choose which type of gloves appropriate for each of the procedure that we are doing in the clinic. All right. Um, we will see the types of gloves as well later. Okay, so These are the types of gloves available regardless which sector that we are working. Okay, so you can see um, the natural rubber glove, PVC, the nitrile, neoprene, PVC, the cotton, wire mesh, caviar, welding leather, and anti-vibration. So these are used in the manufacturing industry, even in the construction also. Okay, none of these are used by us except for the natural rubber, because the natural rubber is being used by our staff to clean up our instruments in the CSSU, or Central Sterilization and Supply Unit. Okay. All right, so these are the difference between the disposable glove used by the medical and dental sector, or we call it health sector. So we have latex gloves, we have nitrile gloves, and we have vinyl gloves. Okay, vinyl normally you don't really see them because it's a see-through. Okay, latex gloves is made of sap from the rubber trees, which is mainly comes from Malaysia. It's made of natural components, and some of these gloves are biodegradable. Okay, for the nitrile gloves, usually used for those who have allergic to the latex glove. Okay, nitrile glove normally not as good as latex glove. It is more fragile than latex gloves, but nowadays a lot of improvement has been made for nitrile gloves. Okay, and then there is a vinyl gloves not being used for us by us to deal with patients. Okay, usually it is made up of plastic. Okay, all right, so when you are wearing gloves, it is important for you to make sure you are wearing the appropriate size of gloves, because you are wearing gloves for a long time, and if not wearing appropriate size, it will harm or it will injure your hands if you're wearing too tight. Okay, but if you are wearing too loose or too big size, your hands will be endangered as well, because you have no control when you are handling any instrument in the mouth or holding something by your hands. Okay, so look at this diagram. When you measure your hands, okay, try to measure from here to all the way on the other side, and that will depict the size of gloves that you should be wearing. Okay, so the centimeters unit also available in inches, so you can measure later. Okay. All right. So the medical gloves are categorized as non-sterile examination, which is this one, and sterile procedure or surgical gloves on the other side. This is way more expensive than this non-sterile examination. Okay. So we are for dentists, we are using non-sterile examination for all of our patients, except when we are do a surgical procedure, we will be wearing this sterile surgical gloves. Okay, indication for gloves use, we have touched this very briefly in my previous lecture, but now I'm just gonna focus that a little bit more. Is when anticipating contact with blood or any other body fluids. As part of transmission-based precautions, you know, when you are trying to avoid the contact, transmission, airborne or droplets, okay? When anticipating contact with chemical hazards, especially with the preserving agents or disinfectants, when you're cleaning your cabinets, your dental chair, okay? When handling sharps or contaminated devices, when undertaking an aseptic non-touch technique procedure, you can use sterile or non-sterile gloves depending on the type of procedures that you're using. Okay, so these are the indications for the glove. Okay, when to remove gloves? As soon as gloves are damaged, when it's broken, when contact with blood, other body fluids, occurred and finished, then you have to change your glove you want to use again, get a new one. Okay. When contact with individual patients and their surroundings or contaminated body sites on a patient has ended, you're done, you dispose it, or if you need to do that again to your patient, change to a new one. Okay, you don't want the patient's blood to dry on your gloves. Okay, so just quickly change that after the procedures. Okay, so not to say that during the procedures when you got blood you change and get a new one and continue with the procedure. No, once you finish the procedure, quickly remove, or if you want to continue the procedure with a different instrument, sometimes we do change. Okay, or if it is more than 2 or 3 hours. Okay, and when there is an indication for hand hygiene, when you need to wash your hands, please remove your gloves. When contact with chemical has ended, and then after completing an aseptic non-touch technique. Okay, we have the aseptic technique lecture later on. Okay, this is how you remove your gloves when you are done, and how do you put on the gloves, okay, before the procedure. So how to put gloves on and how to take it off, or doffing, also also have the protocols. Okay, so you need to see this. I will probably give you some videos as well later on to see how you take it off your gloves and how to put on your gloves. This is particularly for surgical glove or the sterile gloves. Okay. All right. Number 8, shoe cover. Disposable caps and protective footwear should be used where there is a likelihood that patient's blood, body fluid secretions or excretions might splash, spill or leak onto your hair or shoes. So this is particularly for the shoes. Okay, so normally in dental clinic we don't wear this unless there are a lot of blood coming out on the floor. Normally we don't have that in the clinic. Okay, and if there is a splash or there is spills on the floor, normally we would have a procedure that we have to clear it up. Okay, so that's what we're gonna do later in a coming lectures. Okay, all right. So let's look at the procedures of donning and doffing of the PPE. Sequence to don PPE. Don means wear. Okay, how you wear the PPE. First, put your gown first. Okay, cover the torso, neck to the knees, arms to the wrist. Fasten in back and neck and waist. Well, what it means is just to secure your gown with the ties provided by the gown, just to make sure it's not move. Okay, and then put your mask or respirator, fit the mask on, and then put your goggles or face shield, and the last one would be gloves. Why you don't wear gloves first? Because you are touching everything else first and later on put on gloves. Okay, so the gloves pretty much is not contaminated when you are touching everything else. All right, let's look at this video for the donning demonstration.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
Okay, so that is the donning demonstration.
How to safely put on personal protective
Now,
equipment.
Now look at the sequence of doffing the PPE. First, you need to peel off, leaving inside out, and scrub your gloves, and then remove your goggles, then your gown, and lastly your mask or respirator. So why you need to remove your mask at the very last? Because when you are removing the gloves, goggles, or gown, the particles that stuck on the surface of your gloves, goggles, or gown might be flying around in the air. So it's better for you to to keep on the mask until everything's off, and then lastly take your mask off. Okay, and then lastly definitely perform the hand hygiene. So let's look at the video for doffing demonstration.
How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
Okay, so for dentistry, normally for doffing procedures, everything will be done in the patient's treatment room. So we don't have a separate room for you to remove the mask, okay? Just to let you know about that, okay?
How
All right, so that's all about the PPEs. Please do watch the videos if you want to be more well versed with the procedures. Okay, so the videos are available separately in this folder as well. All right, thank you.